This is part 2 for your introduction for mental health nursing. So this slide has to do with what are our goals of care in treating mental illness. It's to increase the number of mental health professionals caring for children and adolescents, to expand mental health services, to understand mental health through a cultural lens and deliver services to minority groups in a culturally congruent and sensitive manner, to improve public understanding of mental illness, to redesign rehab services to meet clients' physical, mental, cultural, and social needs, and to ensure that that interagency coordination and collaboration becomes the norm. What are some methods of achieving optimal care for mental illness? Well, we look at these points. Beyond response to recovery, the aim here is for clients to recover or experience remission and to be restored to pre-illness functioning in various domains, occupational, social, and educational. That's an extremely important point. The aim, I'm going to repeat it. The aim is for clients to recover or to experience remission and to be restored to pre-illness functioning in various domains, rather than just decreasing distressing symptoms and teaching the client to deal with them. A true rehab approach includes interventions that strengthen a client's skills in his or her environmental supports, social and independent living skills, symptom management, job finding clubs, supportive employment, family behavior management, and the use of peer groups in the transition to community living. Second point is reintegration into society. Reintegration in society coordinates social programs with the goal of assisting people with serious mental illness to lead meaningful and more self-sufficient lives. Finding ways to help clients locate safe housing. Finding ways for them to achieve gainful employment, to experience satisfying family and social relationships, and to develop a sense of belonging to the community. Mental health parity. I finally found my notes. Mental health parity was designed to improve coverage for mental health care and close the gap between physical and mental health benefits. It has been revised several times. Lastly, as the Paul Wellstone and Pete Domenici, I think is how you say his name, I'm not sure, Mental Health Parity Act and Addiction Equality Act, which was passed in 2008. It was revised again under the Affordable Care Act passed in 2010. What this law does not effectively do, however, is to require group health plans and their health insurance issuers to include mental health coverage in their benefits packages. So again, take a look at, if you have insurance, take a look at your own insurance and see what it says about mental health care, mental illness, substance abuse, and so on, and see how it compares with the reimbursement rates, if you will, for physical problems. Culturally competent care. A mental health system should value diversity and make the provision of culturally competent care part of its mission. This care needs to be acceptable to the client's cultural background. Healthcare professionals must be able to incorporate cultural factors, including language, customs, beliefs, and traditions into the plan of care. Medication adherence. Compliance means that clients take their drugs as prescribed. Teaching is the most effective way to get clients to adhere to prescribed regimens. When teaching about meds, include the meds, generic and brand names, dosage route, frequency and times to be taken, expected common side effects, and how to treat those minor and common side effects, and possible toxic or dangerous effects, which must be reported to the provider as soon as possible. I want you to look in your book, if you have the 7th edition, at page 15, the 8th edition, page 13, for an example of client-centered education, managing drug therapy. This woman on the slide here, her name is Hildegard Peplau, and she was considered the mother of psychiatric nursing. She, during the 1900s, helped to change the way we look at patients with mental illness. her platform was based on, her platform for psychiatric mental health nursing was based on this statement: the diagnosis and treatment of human responses to actual or potential mental health problems. And she really helped pave the way for modern psychiatric care, if you will. And when you do your BSN programs, you will spend some time learning about various nursing theorists. And I think it's important for us to recognize these women, and I guess for what they have contributed to our profession and where we are going today as a profession. So we look at basic and advanced functions and roles of psychiatric mental health nurses. And certainly here are some of the things that we do: advocacy, health promotion and maintenance, case management, screening, milieu therapy, health teaching, psychobiologic interventions, and participation in the interdisciplinary mental health team. The big difference between basic psychiatric mental health nurses and master's prepared advanced practice nurses, these folks can deliver comprehensive primary mental health services. They can teach and screen, they diagnose, they perform preventive interventions, they evaluate and manage care for people with mental illness. They can write prescriptions, they can do therapy. So there's many things they can do that at a basic level of psychiatric mental health nurse does not have those privileges. What you can do is review the Nursing Spotlight, page 147 in the 7th edition, and page 146 in the 8th edition, and it will lay out kind of the standards of practice for the psychiatric mental health nurse. The psychobehavior role of the nurse, it's the 3 R's. Recognition, we are looking at memory and mood, appearance, speech, thoughts, perception, orientation, relationship, concreteness, empathy, respect, and genuineness, resources or referral, community agencies, hospitals, doctors, psychiatrists, churches, etc. You will assess these things and begin a therapeutic relationship that is professional. Be the link for this patient. What are some guiding principles for the psychiatric mental health nurse? An important role of the nurse is as patient advocate. These principles that are on the slide guide the ethical practice of the psychiatric mental health nurse. Every person is worthy of dignity and respect. Every person has the potential to change and grow. All people share basic human needs. All behavior is meaningful and can be understood from a person's perspective. People have the right to participate in decisions affecting their health and treatment. Through the therapeutic use of self via therapeutic relationships and communication, nurses help people adapt, change, and grow. So, what are some available sources of support and education for family members of clients with mental illness? Well, there's self-help movements, and one of these is the National Alliance for the Mentally Ill, or NAMI. They, one of their primary goals, if you will, is they educate the public that mental illnesses are brain disorders. They advocate for these clients. They aim to eliminate stigma and discrimination. They aim to improve access to services. They facilitate accountability to mental health consumers. They integrate mental illness into community life. And then you've got they also have programs, support and education, like NAMI CAN, NAMICAN, which is a monthly support group for families of children and adolescents with mental illness. Another program is called NAMI Care, and these are support groups for adults with mental illness. They offer Family to Family, which is a 12-session, 36-hour course for families of adults with serious mental illness, and many other programs. The family advocacy movement, instead of a blaming approach, family advocates have conducted research that normalizes much of the behavior that families and clients display, explaining it as an adaptive process. They offer resources and support groups for caregivers to try to reduce family burden and increase coping and adaptation. There's a website for them as well. You can go online and look up the National Alliance for the Mentally Ill, or NAMI, and there's a lot of information on their website. Is the following statement then true or false? The family advocacy movement views families and clients with mental illness as dysfunctional and their behaviors as pathologic. I hope you said false. The family advocacy movement has made enormous contributions to communicating how clients and families experience mental illness. The healthcare industry once viewed families and clients with mental illness as dysfunctional and their behaviors as pathologic. So the family advocacy movement has attempted to normalize much of that behavior that families and clients display, explaining it as an adaptive process. Here's a question for you. So then, who are the team members that make up the interdisciplinary mental health team? And what I want you to keep in mind is that interdisciplinary collaboration is very crucial to the care of the client and family with mental illness. Nurses play a very crucial role on this team. Here are some of the folks that are on our team: psychiatrists, psychologists, advanced practice nurses, psychiatric mental health nurses, pharmacists, psychiatric mental health technicians, dietitians, occupational therapists, social workers, spiritual advisors, art therapists, play therapists. One person that I left off this slide, perhaps a music therapist. So there are different people that can make up the interdisciplinary team. What is the role of the nurse on this collaborative team? We plan interventions to help clients achieve goals established by various members. Then we ensure that goals are not in conflict and gather contributions, input, and feedback from clients, family members, and other caregivers. The nurse is meeting a new client on the unit. Which action by the nurse is most effective in initiating the nurse-client relationship? I hope you chose A. Introduce yourself and explain the purpose and plan for the relationship. What is a therapeutic relationship? It's the foundation of all nursing care. It's defined as a close helping relationship based on trust, which fosters collaboration. Its purpose is to help clients solve problems, cope more effectively, and develop and achieve developmental goals. The essential elements of a therapeutic relationship include trust, professionalism, mutual respect, caring, and partnership. The therapeutic relationship remains a central medium through which all psychiatric care is provided. And you learned in fundamentals about 3 phases of the therapeutic relationship. Remember, introductory, establish rapport, and build a foundation for future work. The working phase, where you work to achieve goals set during the introductory phase, and termination is to review the work that has been done, discuss remaining questions, applaud the client's progress, and bring the relationship to an end. Here's a question. A nurse who attends to a client's needs in a timely manner is displaying which essential element of the therapeutic relationship? And I must tell you that all of these are central elements of the therapeutic relationship, but the answer that we're seeking here is D, or caring. Caring includes meeting the client's needs in a timely manner, includes the giving of the self, and providing comfort measures for clients and families. There's a couple of terms that you need to become familiar with. What is transference and what is countertransference? Transference are where there are feelings and thoughts that clients have toward the nurse, psychiatrist, or other service provider. The client is thought to project an imagined image about the provider, which may be negative or positive and may hamper or help the treatment process. The client unconsciously displaces or transfers feelings formed toward a person perhaps from his or her past to the nurse or provider. This may take the form of overwhelming affection with unrealistic expectations of the nurse or provider by the client. When the nurse or provider does not meet the client's expectations, the client may become angry and hostile. As far as an intervention here, the nurse should work with the client to sort out the past from the present, identify transference, and reassign more appropriate meaning to the nurse-client relationship. Countertransference are feelings and thoughts that service providers have toward the client. The provider may harbor certain images of the client that result in blind spots, which can be destructive or disruptive to treatment. With countertransference, the nurse may project feelings based on unresolved positive or negative feelings from the past onto the client. The intervention for this is the nurse must be aware of and deal with these feelings to be objectively therapeutic. These both can hamper the therapeutic relationship. Why is self-awareness considered a precondition for establishing therapeutic relationships? Nurses must be able to monitor and contain their own anxiety when clients discuss frightening incidents or relate tragic events that generate feelings of hopelessness or despair. Nurses must be aware of countertransference reactions. Nurses must be mature in their dealings with their clients, and nurses must be able to show empathy. Listening to clients without mentally or physically fleeing from the situation or offering impersonal platitudes is key to the therapeutic relationship. Countertransference reactions, both negative, rejecting attitudes, and overprotective, rescuing behaviors on the part of the nurse and or mental health care provider, can negatively impact that therapeutic relationship. Have you ever had a patient that just touched you so that you wanted to just swoop in and just help them maybe more than you should even do that? Or what about a patient that just brings out kind of a negative, rejecting attitude in you? So we have to be very careful of that, particularly when we're caring for patients with mental illness. How can nurses avoid countertransference reactions? We nurses need to monitor our levels of patience and flexibility in dealing with persistent behavioral patterns that resist change. Nurses must seek support and supervision when they become frustrated with clients. We'll talk more about this as we go on. What is therapeutic relationship or communication then? It is communication that occurs when the nurse demonstrates empathy, uses effective communication skills, and responds to the client's thoughts, needs, and concerns. It is a planned process that allows the nurse and client to build a trusting relationship in which the client is free to express thoughts, feelings, and options without fear of judgment. It is based on communication skills that nurses learn to implement through careful practice and experience. What is a major part of communication? Listening. This is number one of 4 very important communication techniques used in psychiatric mental health nursing. In active listening, you want to maintain eye contact, facilitate close proximity if this is not threatening to the client, project a relaxed physical orientation, speak calmly, minimize distractions like TV, other patients, family members, and so on, prevent interruptions, attend to the client's physical comfort. Some other helpful communication techniques include making an assertive statement based on adult-adult communication, not talking down to clients. We need to show empathy, acknowledge the other's viewpoint, express the conflict from a personal view or experience, and make a specific plan or a proposal. Nurses can model assertive behaviors to clients to show them assertiveness versus aggression with I messages. We'll role play some of this in class. The third communication technique is using confrontation. It is the skill of pointing out in a caring way the discrepancies between what clients say and do. It's a 3-step approach for confrontation, and it's called a perception check. Describe the inconsistent or confusing behavior, offer at least 2 possible interpretations of that behavior, and ask for feedback. A perception check does not accuse the client or make assumptions about them, because two possible interpretations are offered. By giving alternatives, nurses make the message tentative and leave the situation open for clients to provide feedback. Lastly, using a technique called positive reframing. When limits must be set on a client's behavior, specifically stating the desired change is more effective than criticizing the negative behavior. And again, we'll do some examples of this when we meet in class. So, sometimes we nurses use a technique called self-disclosure, where we disclose a bit about ourselves to the patient. And I want to caution you particularly about that in psychiatric mental health nursing. Nurses use self-disclosure in the nurse-client relationship only after careful consideration of its therapeutic benefits. If it's not therapeutic, don't go there. Small amounts of self-disclosure by nurses can sometimes be therapeutic. Limited self-disclosure can enhance trust, decrease role distancing, facilitate the client's self-disclosure, convey support, or normalize the client's experience. What are the guidelines for the nurse's use of self-disclosure? Use self-disclosure to help clients open up to you, not to meet your own needs. Remember, it's not about you, it's about them. And the important thing is to always keep the client at the center of your care. Keep your disclosures brief. Be careful not to imply that your experience is the same as the client's. Every situation is unique. Disclose only those situations you have mastered. Do not use self-disclosure to discuss painful situations from which you have not recovered, because this reverses the nurse-client roles. If you have a tendency to talk too much about yourself, work on trying to curb this and listen more to clients. Bear in mind that the amount of self-disclosure considered appropriate or comfortable varies according to culture. Monitor the client's nonverbal behavior to determine whether he or she is receptive to your self-disclosure, and respect the client's need for privacy. So, some trends in healthcare. And you kind of think about like trends in mental health care, trends in healthcare in general. But we need to think about the aged population increases. The incidence of chronic illnesses and disabilities requiring mental health care will also rise. By 2020, violence and self-injury are predicted to be major worldwide disabilities. The burden of psychiatric illness is immense and expected to grow. The more mental health services provided, the more professionals will be needed. Should mental health be a national priority? Well, back in 1999, Dr. David Satcher, who was U.S. Surgeon General at the time, issued a report called Mental Health, a Report of the Surgeon General. His intention was to turn national attention to and focus it on mental health as a national priority. To date, not only was this the first such report issued by a U.S. Surgeon General, but sadly it was also the last such report. It contained the following messages. Mental health is fundamental to and necessary for a healthy life. Mental disorders are real health conditions with enormous consequences for individuals, families, communities, and the nation. Effective treatments for mental disorders are available. Most combine psychosocial interventions and psychopharmacotherapy. A range of treatment options is available for most mental disorders, and those with mental disorders or symptoms should seek treatment because it can help. So where do we begin? Well, you know us nurses, with the nursing process, of course. How does the nurse use the nursing process? How does the nurse, I have this mistyped, I think. How does the nurse use the nursing process and apply the nursing process to psychiatric mental health nursing? Are there differences? Are there similarities? Mainly, we're going to talk a little bit about this in class because we're going to look at the nursing process and work on some assessment strategies. So as you can see under assessment, we'll use interviews, history, mental status exam, psychosocial data, physical exam, laboratory and diagnostic testing. Not that much different. Diagnosing will use data analysis and clustering, nursing diagnosis selection, prioritization. We'll identify our outcomes and planning. We'll implement basic interventions, counseling, milieu management, promotion of self-care, medication management, client education, health promotion, and advanced interventions done by those advanced practice nurses or other providers with advanced degrees have to do with psychotherapy, medication prescribing, and consultation. And lastly, evaluating termination of nursing care or revision of plan of care. Nurses and clients work together as partners to promote health, prevent disease and illness, restore health, and facilitate coping with altered function. So we're going to work on some care plans. We'll do some in class. We will be doing some when we do our simulations. So I thought this was kind of a cute comic, Atlas of a Nursing Student Brain. And so when you're thinking about care plans, sometimes that's the last thing you want to think about. Now take a deep breath. We are getting ready to learn an awful lot about mental health. Are there any questions? Are there more questions than answers? And I hope that over the course of this mini-mester, I'll be able to help you find the answers to many of your questions. This is it for the Introduction to Mental Health podcast.